Muchas gracias, doctor Biu. Es profesor de Medicina en el Laboratorio y adjunto de Patología y Química de la Universidad de Connecticut y recibió su grado en la Universidad de Illinois, postdoctorado en Hartford y profesor asistente de Patología y Medicina del Laboratorio en la Universidad de Texas, Houston. Investiga en marcadores bioquímicos de enfermedades cardiovasculares y drogas de abuso, y sobre todo por test de point of care. Marcadores cardíacos, CK, LDH, mioglobina, troponina y más recientemente péptido natriurético tipo B. En drogas de abuso, screening en orina de adulterantes y alcoholes volátiles. Tiene más de 250 papers, abstracts y capítulos de libros, entre ellos marcadores cardíacos. Es miembro, editor y coeditor del Clinical Chemistry y de la Clinical Chemistry Acta, miembro de ACC del Comité de Estandarización de CK y de IFCC en el Comité de Estandarización de Marcadores Cardíacos. Ha recibido numerosos premios como a jóvenes investigadores, el mejor artículo y mejor conferencista. Es un gusto tener al doctor entre nosotros. Es director del programa de certificado de formación postdoctoral en Texas y representante de ACC en la Comisión de Acreditación en Química Clínica. Interviene en formación de becarios y residentes en patología. Muchas gracias, doctor Biu, por estar con nosotros en este congreso.
Thank you, Graciela, and thank you all for attending my lecture today. I'm sorry that I cannot be with you in person. These are unprecedented times for all of us, but it's good that we can continue on and do the science and the medicine that is so important to everybody. So today's talk is going to be very different from anything else that you will hear this week, including my talk later tomorrow. I have a separate mission beyond the science and medicine, and that is I hope to promote the value of our profession to the everyday general public. I want to convince you why this is important, why it is important to do this now, but more importantly, I have a three-part plan as to how this can be achieved. It is something that I've been working on for the last 10 years, and I think it's coming closer to reality. So why is the time now? In the US, and I imagine everywhere else in the Americas, that there is reduction in funding for research. And at least in the United States, this is going to threaten the leadership of biomedical research in our country. 2 years ago, then President Obama passed the Affordable Health Care Act, and part of that was something called PAMA. PAMA is a series of budget cuts for the lab that was necessary in order to fund the Affordable Health Care Act. And this has put quite a damage to our operations because very few people outside of our profession really understand what we do and why what we do is so important. So I want to note that when the slide has a blue cover here, that is something that you will see again. So there will be several themes that will be repeated at the end of my talk. So this is a plot of the expenditures in healthcare as a percentage of the gross domestic product in the United States. And as you can see, from 1965 to 2015, 20 cents of every dollar is spent on healthcare. This is not sustainable. We cannot continue to spend this much money. And this is why PAMA was initiated, which is why the reimbursements to the clinical laboratories have been cut. So this is why we need to educate the public now. This is healthcare expenditures in the other American countries compared to the United States. And you can see here that they're not as high as the US. We obviously spend much too much, but you can see Uruguay is number 5 on this list. Brazil, not far behind. Argentina. So we are spending a lot of money. And if you're not experiencing expenditure cuts today, I predict that you will be experiencing budget cuts in the near future. This is what I'm trying to avoid. The time is now. And so we have to change the perception of our profession. Right now, we are the tame pussycat. What we want to be is the aggressor, the dominant force, the people who can depend on, because after all, we don't want us to become a commodity. So when you go to the store and you want to purchase toilet paper, I don't think you care what the brand is. They're all the same. But clinical laboratory testing is not like a commodity. There is much effort behind generating a good quality result. And if we don't act, then we will just be like anybody else. You buy a product off the shelf, you may be competing against different laboratories for a cholesterol test. This is not what we want. So this is my 3-part solution. Part 1 is to convince you that what we do is important. This is the easiest part because, quite frankly, I don't need to do any work. You already know that what we do is important. More interestingly, though, can it be done? Can we change the paradigm? The answer is absolutely. This is the changing dietary paradigm across the world. We purchased organic produce. We study nutritional labels. We eliminate trans fats. We avoid genetically modified products. Our diet has improved in the last 20 years, and there was no revolution. There was no advocacy. There was no declaration. It was done because it was the best thing to do. So I ask this question. If we're so interested in what we put into our body, why are we as a country or as a world not interested in what is being done to our body in the form of medical decisions? It doesn't make sense. We should participate in our medical care. We should be having a role in the decisions that are being made. And yet, that is not the current way healthcare is provided. And so if we don't change this perception of what we do, then healthcare dollars has already begun to diminish in the United States. And with that, I fear that we're going to see an increase in medical errors. So how do we change our fate? What are we going to believe in? So I'm going to come to the punchline, to the beginning of my talk, so that you have this in mind as you're listening to my talk. The answer is a television show. I am working with some Hollywood agents, spoke with them yesterday about creating a television show that is based on the life and career of clinical laboratory professionals like you, like me. And I believe that if the show is entertaining but yet truthful and compelling, that people will watch and people will learn and they will understand what it is that we do. And so at the end of my talk, I will show you a trailer that I have prepared that has been shopped around to different Hollywood studios. All right, so, but before we can have a television show, we have to have content. It can't just be an idea. It has to be a screen-written script. It has to have memorable characters, engaging situations, even villainous antagonists, if we're going to make this a popular show. My objective is not to have a science-based show, not to have a documentary, because that doesn't reach the wide audience. That reaches a scientific and a knowledgeable audience like us. I want to reach the general public who may not be interested in science, may not have any medical issues to deal with today. But after watching my show, they will understand why what we do is essential. And so many of you know, and if you've come to the ACC meeting, you know that I have published a series of paperback books that have been sale for 5 years. They have been translated into Italian, Chinese, Korean. I would love it if somebody can help me translate this into Spanish or perhaps even Portuguese. But these are the basis for the stories that I have pitched to Hollywood. That these are real stories, real science, where the clinical lab has either been the hero by making the right diagnosis, doing the right test, or sometimes the laboratory contributes to mistakes and medical errors. Not so much by the lab, but errors that are contributed by physicians not understanding our science. So I want to go over some of these. And one of the important themes throughout my career has been education. And so we started a program for teaching pharmacy and medical students about pharmacogenomics. And we did that by offering pharmacogenomic testing to these individual students under a consented protocol. And based on that, I wrote a story. I wrote a story called Clopidogrel, and notice that it is in blue. You will hear this story again. So it's about a student of mine who has a STAR2, STAR2, 2C19 polymorphism and is at risk for thrombosis following a coronary artery stent. Now, her father suffers a myocardial infarction, and he wants to put Frida's father on the Plavix. But because Frida has this reduced metabolism genotype, and knowing that one of the alleles came from her biologic father, she tries to tell the doctor that Plavix is not the best drug for my father. We should consider another drug. But the doctor was not happy that the student was trying to educate him on how to manage his patient. He put the father on Plavix, and unfortunately, it didn't protect him from his heart attack, his second heart attack that occurred a month later. This one led to his death. This is partially a true story. I did have a student. She was a STAR2, STAR2, but it wasn't her father. It was her grandmother who died of a stroke. This is a story about a woman who had a false positive HCG. Now, this one is on us. As a result of this inappropriate lab result, she and many others underwent unnecessary chemotherapy, hysterectomy. The obstetrician believed that Jennifer here, a true story, suffered from a gestational tumor. And this was a false positive result. And these are the other patients that also had these adverse decisions made on them. So who's at fault here? I would say that everybody listed on this page is at fault, including the patient. Why? Well, we as laboratorians, this is well known by all of you, know about the so-called heterophile or gamma interference. This paper was called the phantom HCG. It's when this antibody binds to the capture and the signal antibodies in the absence of the analyte to produce a false positive signal. Now, here's where the patient has some negligence. This was a blood test. Had she gone to her local pharmacy and purchased a urine pregnancy test, having been told that she had a positive HCG, she would have seen that the result was in disagreement with her doctor's finding, because heterophile antibodies do not get excreted in the urine. That her urine would have been negative. So this is what I'm saying. We need to educate the physicians, but more importantly, we need to educate patients and the general public. Because if you don't, these are the kinds of things that can happen to you. Here's another situation about a false positive glucose result using a device that uses the GDH-PQQ enzyme system. The FDA recalled this device. It's no longer available. But 10 years ago or 12 years ago, there were a number of deaths from people who got a falsely positive glucose result. And so I wrote a story about a woman who developed pelvic inflammatory disease, had surgery, and in the ICU, she is given a lubricant called icohextrin. Icohextrin keeps her from reforming adhesions, and glucose is monitored to within tight glycemic control. These are the lubricant, the adhesions that we sometimes see. Well, the problem with icohextrin is that it breaks down into these saccharides, these di, tri, and tetrasaccharides, and the PQQ glucometer produced a falsely positive result. These individuals were diagnosed as being hyperglycemic when in fact they were euglycemic. They were given insulin inappropriately, and many people died. A laboratory result had such a major consequence. Another one of my books, very much in the news today, is microbiology. So let me start with this case. This is about two boys. Obviously, they are identical. One boy goes to a West Coast college in the US, another boy to the East Coast college. They come home during winter break. They catch the H1N1 influenza. They're sick. They go back to school and they visit their school's hospital and laboratory. The West Coast hospital lab does blood cultures. It takes 2 or 3 days to get a result. There's no information on antibiotic resistance. The patient is given a broad spectrum antibiotic, and unfortunately, the resistance is such that it doesn't work, and the boy on the left dies. The boy on the right goes to a school whose laboratory uses a molecular test. Diagnosis is almost immediate. Information on resistance is given. The correct treatment is given. The patient survives. Here we have a situation where we have identical genetics, identical route of infection, the same organism, different medical outcomes, simply because of the choices that the laboratory had in working up this case. So I want to ask you if this has ever happened to you. You're at a party, you're at a gathering, and you're meeting perhaps your future mother-in-law or maybe son-in-law. And the manager says, the mother-in-law says, "What do you do for a living?" And the clinical laboratorian says, "Well, I work in a clinical lab. We perform lab tests." And the mother-in-law, not understanding exactly what that means, asks if this person is a physician. and starts to tell her about her own medical problems. The manager says, no, we provide laboratory data that makes, that produces information that physicians can make decisions. Unfortunately, it went over her head, a glazed look in her eye. She responds by saying something trite and then leaves to return to her cooking. This has happened to me. I am willing to bet it has happened to you. Your own family members don't understand, or more importantly, don't appreciate what it is that you do. This has to change. And this is why I am working so hard to do this. I'll give you a couple more cases. This is 3 individuals back in the year 2001 who were exposed to anthrax. And this was shortly after the 9/11 attack on the United States. During that time, I was in Connecticut and had an appointment with the pathobiology department. And we had a graduate student who was doing anthrax research. Now, I'm a clinical chemist. I don't do anthrax research, but he was in my department. And when the 9/11 attacks hit the US, the then Homeland Security told everybody, you have to discard all strains of anthrax. Now, this individual was almost complete with his PhD thesis. He didn't want to shut down his research. And so instead, against his major professor's advice, he takes the culture home, he puts it into his own refrigerator, and he labels it special sauce. He goes away to the American Society of Microbiology meeting. His girlfriend is left home in their apartment. She's eating leftovers. The bottle is disguised, doesn't know that it has anthrax spores. You can imagine what happens then. Okay, so this is only a partially true story. I did have a graduate student. He did have live cultures, but he didn't accidentally poison his girlfriend. Part of the reason that I present this case is that we have to have stories that are compelling, stories that have real science and real medicine, as this one does, but it also has to be entertaining. This is another story about the space station, about an astronaut who works in zero gravity. He's doing C. difficile culture. There's a little hole that was created in the glove box. And usually, when you have gravity, the organisms just float to the bottom. Can you imagine if there was COVID in the space station and someone sneezes? You'll never get rid of it. This is the story that I wrote. Another one of my books is on toxicology, because what you don't know can kill you. So another one of these true stories, very compelling, is about this grandmother visiting her son in the United States. She's from Taiwan. She's visiting her son and daughter-in-law and babysitting her grandson. So the parents of the child is out for an evening dinner, and the grandmother is babysitting. So she goes out to the field nearby and picks fresh mushrooms for the meal that she wants to make. Okay, so this is the mushroom that she eats in Taipei. It's very tasty. I've had it before. Unfortunately, it looks identical to the form that's found in Northern California. This Amanita phalloides is highly toxic. Honest mistake. She made this meal. She poisoned both herself and her grandson. A hepatologist is called. We are called to verify that this is a Amanita phalloides poisoning. There's a test that we do called the Mixner test. While the a doctor is trying to find a solution, he contacts a colleague in Germany about a novel treatment for mushroom poisoning based on milk thistle. Not FDA approved. He doesn't have access to it, but he contacts the FDA. He gets special permission to send a vial of the antidote to North America. But he fails to tell them, or I guess he forgot, that there were, in fact, 2 people. And so when the shipment came, he realized his mistake. He only has enough milk thistle to treat 1 patient. It would be too late to get the second shipment of milk thistle. And the family had to decide, and this part is a true story, which of the 2 are going to get the drug first and the other one later. Not going to tell you which one they decided, because then you won't watch my television show. Okay, a professional golfer orders an erectile dysfunction drug over the internet, and he hooks up with a fan after the event. He gives her the keys to his condo with a full intent of having sexual intercourse. So he uses a double dose of this erectile dysfunction herbal, and you can probably guess what happens next. He overdoses. He ends up having a heart attack the next morning while in bed. So I wrote this story 7 years ago. We did do an analysis of herbal medications. They don't contain natural substances. They contain designer sildenafil, that is the active ingredient in prescription herbal medications like Cialis. But then there's this story about this basketball player. His name is Odoms, who is then a member of the Los Angeles Lakers. He goes to Las Vegas, orders this herbal Viagra, similar to the compound that we studied, and he ends up having a stroke. He is married to one of the Kardashians, Khloe Kardashian. He survived, but he has permanent impairment. He unfortunately didn't read my story, didn't know that these things could be dangerous. And then there's this plane crash. So I don't want to say that everything that we do leads to bad things. Sometimes the things that we do are heroic. And this relates to a plane crash that occurred at San Francisco about 4 years ago. It's a Korean airline that came too close to the runway, and you can see that the tail section crashed and broke into pieces. There were many people who died from this plane crash. But I don't want to focus on the crash. I want to focus on the evacuation. The evacuation took place, and you can see here from this figure that people can jump out of the onto the wing or onto these inflated airbags on each of these doors. There would have been some in the back here as well. But I want you to focus on this. Okay, so the US FAA says you have to build planes so that everybody can get out in 90 seconds. There's not going to be a large number of people that are going to get out in 90 seconds if you put a ladder there. Okay, so the ladder was put in afterwards. It wasn't part of the evacuation. What happened was that the airbag exploded inside the plane, knocking over 2 flight attendants, and they were unconscious while this plane was burning. The pilots come out of their cockpit. They see that their colleagues are about to be exposed to toxic smoke. They slice open the bag with a knife. They pull these two women out. They are rescued. They come to my hospital. We are now charged to determine if the two women were exposed to a toxic chemical. And what was that toxic chemical? It's sodium azide. We know in the laboratory what sodium azide is. It's used as a preservative, but we also know as an antibiotic, but we also know that it is highly explosive. And this is how airbags in our automobiles, as well as in our evacuation chutes in airplanes, deploy. In an automobile airbag, it's about 150 grams. In an airplane chute, we're talking many kilograms. And these women were covered with unexploded toxic chemical. We set up a method using our time of flight mass spectrometry procedure within 24 hours and had results on the amount of exposure that these flight attendants had. We don't normally test for sodium azide. I would doubt that anybody listening to me today has an assay in their back pocket. We did find a literature report that we judged our testing on. And then the fourth book that I have written is on performance enhancing drugs and adulterants. And I just want to show you one case. It's about this tennis player who is African American and is tested according to college guidelines for sickle cell disease or trait. Unfortunately, the NCAA, the National Collegiate Athletic Association, didn't use the best procedure. They didn't use an electrophoresis like we would do. They used a simple point-of-care device called the Sickledex test. Now, this is something that was over 50 years old. It's been well known that you can get erroneous results, especially if patients are anemic, as this woman was. She was misdiagnosed. She was given a clean bill of health. She went on to play tennis in a rigorous match in Denver, Colorado, which some of you may know is up in the mountains, high altitude, low oxygen. She collapses. Laboratory tests leading to an inappropriate medical decision. Now, I wrote this book with a central antagonistic character by the name of Calvin. It became apparent to me that if I want to have a TV show, I have to have people who are both good and bad, a conflict between good and evil. Of course, we are on the good side. But Calvin is a medical technologist in my drug testing lab, starts out to be very honorable. He's doing a drug test on a school bus driver who's adulterating his urine. And he comes to me to say, I know he's cheating. We need to call him out, but laws do not permit me to do additional testing. And I told him that we have to let it go. One day, the driver of the adulterated urine is involved in a traffic accident because he is high on heroin. Unfortunately, this traffic accident leads to the death of Calvin's family. Now, this part is fictitious. So Calvin, disgruntled that he could have stopped this, turns to the bad side. He ends up forming a company that makes adulterants and performance-enhancing drugs. And even though I says he leaves the lab, which is written in the story, he actually continues to do this under my nose in a side research lab without me knowing it. He's producing adulteration products and performance-enhancing drugs. He has joined the dark side. It's similar to this TV show maybe you've seen it. I don't know if it's shown in South America, called Breaking Bad. It's a high school teacher who ends up making methamphetamine for a living. This is another story in that book about these two women who are competing in sports that favor a prepubescent physique, ice skating and gymnastics. And what they have in common is that, number one, they're not children, they're adults, they're 18 years old. And the reason that they don't look like that is because they have abused puberty delaying drugs that delay menarche. And this is a known endocrine problem that precocious puberty, women and boys, girls and boys who develop too soon and are given these hormones to retard their development. And somebody who's normal, given these drugs, can lead to, as you can see, brain tumors, short stature, and breast cancer down the road in women. So can we really change our outlook? I mentioned that it is based on an idea for a television show. And this is the basis for that idea. Crime Scene Investigation. This is a show that ran for 15 years, had three spin-offs, almost 1,000 episodes. And if you've never seen this show, it's about scientists who use modern laboratory science to solve crime. The shows before CSI all focused on doctors and nurses, and the lab was always secondary. Well, send it to the lab. We got a result instantly, and here's what we did. Okay, that's not real. Crime Scene Investigation, the television show, showed the public that there is a lot of background and that, in fact, the scientists can be the key. So what is the so-called CSI phenomena? What it has done in the 15 years that it ran led to increased enrollments in students who wanted to become forensic scientists. They led to increase in budgets in crime labs. Today, if you go to a courtroom and you are in the jury and you are presented scientific evidence about why something happened, there is a higher level of acceptability because of this show. I would also hesitate to say that O.J. Simpson, remember O.J. Simpson, who allegedly killed his wife, his ex-wife, Nicole Brown Simpson, back in 1995, before Crime Scene Investigation became a program, that today, had that happened, the miscues that the science lab did in investigating that case would not have happened, because the quality of forensic science has improved as the result of a television show. Well, this is what I think we can create. We can create a television show, not to do a better job at solving crime, but to do a better job at solving health, at making diagnosis, of making people better. And I would venture to you that this is a bigger mission than solving crime. And so this is my proposal. Clinical laboratory investigation. Every week, a different story. And I have concocted over 150 stories that could be turned into a television program. Why now? Well, prior to the pandemic, you can see this headline: Netflix content budget updated to $13 billion. Today is this headline: Netflix eager to restart production and needs content for 2020. The time is now to act. So who's going to play my part? I threw in some faces of famous Uruguayans in Hollywood. I'm afraid I don't know who these people are, but maybe many of you know who these people are. We're looking for somebody who can be distinguished and can play the part of the clinical lab scientists. And so I want to leave you with this last story and then show you my video. So this is a COVID-19, circa February 2020. First patient arrives in the US. We gather the leadership and talk about personal protective equipment and how we're going to do testing and who's going to do testing. And one of my techs, who was fearful of contracting COVID, says, "Don't ask me to be that person. I have small children at home. I cannot afford to be infected." The manager working for me questioned him about his motivation the next day, away from my presence. And the tech came to me the day after and reverses his stance. I feel ashamed of my attitude. You're right. We have a bigger mission here that we have to do. You can count on me when it comes time to do COVID. And that individual right now today is front and center involved with doing testing every day, as I'm sure your people do in your facilities. And so it begs the question, lab workers are put their lives at risk doing testing every day. Who are our heroes? Well, I can say that it's not the cartoon characters. It is the firemen. As you probably know, Northern California is on fire and has been for the past month. We've had a lot of uncontrolled fires even to this moment. These people are our heroes. But then so too these people, the people who work in the lab, the people who do the testing at some risk to their own health because of the possibility of contracting COVID or anything else for that matter. And yet we are not getting the recognition that we deserve. And I think with a television program, this is possible. Okay, so I promised you a video. I'm going to pull it up now. I can tell you that this is an amateur video. It was produced by a medical student of mine. It's incomplete. It has a couple of themes. It has a couple of actors, but mostly it's me, and mostly it's a concept.
70% of all medical decisions are based on the result of a clinical laboratory test. And yet, most people, even doctors, don't understand the behind the scenes that go on in generating these test results.
Just got back from a conference call. They're proposing more cuts. This is getting ridiculous. Do they not understand that patients will die if they cut funding to our lab? I'm telling you, Dr. Wu, this guy is an addict, and he's altering his urine sample to get a false negative. Let me run a B-Bean test to prove it. Calvin, our job is to run the tests that are ordered and provide the results. You need to drop this personal obsession right now before I take disciplinary action.
So the test came back negative. Should a kid just has a cold?
He's exhibiting flu-like symptoms. We should run a molecular test.
We don't have the money for that kind of test here.
If that kid dies, his death is on you.
It's time for all of us to take control. If you are in control of knowledge, that is power.
I'm prescribing clopidogrel to keep his arteries open. Any questions? Dr. Logan, I don't think that drug will work. My father has a CYP2C19 mutation, which means that the drug may not be able to, honey, we don't do 2D19 testing here. We follow the standard protocol, and I believe clopidogrel will be just fine. Now, if you'll excuse me, I have other patients to see.
It's no longer acceptable for us to just assume that your doctor knows the best about your body. If you don't pay attention and you don't take charge of some of the medical decisions that are being made, then bad things happen.
Okay, so with COVID, I missed the 2019 deadline. We're nowhere close to having a show, but we are moving forward. I can tell you that the kid on the train is the producer of that skit, and he put himself in it. And then those two doctors in the, those are my kids, and they're not doctors. So thank you very much. I hope that you've enjoyed my presentation.
Thank you very much, Doctor. You are very interesting in your lecture. I know one question. I like to purchase your books. Where can I get it?
Well, unfortunately, they're only written in English, but they're available through Amazon.
Amazon, thank you. Doctor, queremos agradecer el programa de Visiting Lecture de IFCC que nos ha permitido tener esta brillante conferencia entre nosotros. Muchas gracias, doctor.
Thank you.
Una sola pregunta más. ¿Qué opina de los teranos?
Okay. So I actually worked with Elizabeth Holmes after her company was closed for the clinical lab, and she tried to develop a laboratory diagnostic test. So she made a lot of mistakes, but I don't think that she was as evil as the rest of the world has portrayed her. She was, I believe, genuine, was actually quite gifted and smart, but unfortunately listened to the wrong people at the wrong time. And by the time that the various people who are expert in the field got to her, it was too late. She didn't engage us until it was too late.
Thank you very much, Doctor. Thank you.